joining us from all over the world. My name is Vishal Gondal, and I am the founder and CEO of GOQii. We are truly in a very, very unprecedented time. It is said that the situation right now in India is possibly worse than even the wars or the partition which India has encountered. uh, Millions have been infected, thousands are dying, and the situation, while in certain cities, is coming under control, and we are seeing some kind of a stabilization or dip in the peak. Clearly, we are seeing smaller cities and villages getting impacted. In this scenario, I think the only glimmer of hope we now have is how are we going to deal with the situation once the wave two is over. We all are hoping that now it's just a matter of a few more weeks or months, depending on which city you are, where we are going to start seeing the decline in cases. So, to discuss this with me and the entire concept of prevention or preventive healthcare, I have somebody none other than Luke Coutinho himself. Luke is a very, very dear friend, a co founder of GOQii, and somebody who has pioneered holistic health, holistic lifestyle, and integrative medicine for several years now. His passion for making people healthy, for talking about health and nutrition, has not only got him accolades and so much recognition. Recently, what Luke did also made him a hero in the eyes of everybody. He made a donation of a large sum. I don't want to tell you the amount. You can Google that, to Paytm, in their endeavor to provide oxygen to the country where there has been a lot of shortage. With that, I like to welcome Luke. Luke, welcome to the show.
Hi, Vishal. It's so good to be with you again. Thank you for having me.
No, thanks, Luke. Thanks for being here. I think in today's world, the question going on in everybody's mind is what can they do? There was a thought process before that this virus was only affecting the people with comorbidities or people who are older, but suddenly we are seeing the impact of this virus on people in their 20s, people in their 30s, and it is widely said that the wave 3 is going to impact kids. So everybody wants to know what can they do to prevent and build their own immunity in a way that they can be ready to face this challenge.
So, Vishal, a couple of months ago, I would say it's all about your immune system. It still is all about our immune system. But what I would like to add to that point is what can we learn from nations and countries where they've managed the virus very, very effectively? What have they also done? You know, people say the virus is mutated, we can't understand it. But then we also have to look at what the facts are. Because when epidemics and pandemics like this happen, most people's reactions are out of fear, emotion, of course, loss of loved ones, insecurity. But once you push that aside, you're always left with some facts. And yes, people said before that, hey, now everyone's getting it. Everyone is still not getting it. Some people are getting it, maybe a lot more. The demographics have changed now. Before it was people with diabetes and COPD and all of that stuff. They're still getting it. I spoke to a head doctor at an ICU hospital in Bangalore a couple of days ago, and I said, what sense are you making out of all the 20-year-olds and the 21-year-olds getting it? He's saying, Luke, yes, it is different. It's changed from what it was. But again, when we're questioning them and talking about them, a lot of them are chronic smokers. A lot of them are chronic drinkers. So you see, lifestyle still plays a part. Just because you're 20 doesn't mean you're healthy. There are loads of unhealthy 20 years out there as well. Just because you're in your 30s and you go to a gym doesn't mean you have to be fit. Physically, you may be fit, but what's going on inside of your body? Now, when I compare it to the statistics, which even GOQii's collected through the Fit India report over years, and if we pull out the data, which is now documented, what are some of the biggest problems in our country? Ranging from gut problems to acidity to everything that ties in the immune system, inflammation. These are key words that are playing a huge role. Your own inflammation response to the virus is killing you today. Okay, inflammation is supposed to be a good thing to protect us, but now it's become our biggest enemy. So when we break it down, yes, there is still a lot that we can do. Number one, to focus on our immune system. I would like to tell people it's not about boosting your immune system. You can't boost it, but you can train it. because your immune system is like, just picture this in the simplest way possible. It's like an army of soldiers. Now, we can feed soldiers the right food, they have the right energy, but if they don't have the right training, they can't be a solid army. That's why you have intelligence in an army. So a trained army is able to be more effective than an untrained army. The immune system has to be trained the right way. Training is not just about food. I mean, people for the last 1 year have learned to eat more garlic and ginger and turmeric and do steam inhalation. That's one part of it. But what trains the immune system? Our environment outside of us and inside of us. If I'm in an environment with a lot of fear and anxiety, I collapse my own immune system. This is documented science and medicine. If I'm sleep deprived, I collapse my own immune system, irrespective of what medication I'm taking. If I'm constantly sedentary, I don't have the right amount of blood circulation, my immune system may be strong, but it's not smart enough. It's not smart enough. So yes, some people's immune systems are creating a cytokine storm that kills you eventually. Some people are left with fatigue, chronic fatigue syndrome, pain in their legs and their arms, but they're surviving. So you see, it's hitting everyone differently. It still comes down to the basics of how strong and how smart is your immune system. And for that, at this point, we have to look beyond just food. We have to consider the importance of sleep, the importance of movement, the importance of rest, the importance of stress. For the longest time, the world has said, oh, everyone has stress. So my point is always been, so yeah, everyone has stress, but what are you doing about it? If stress is a problem, what are you doing about it? Just because everyone has it doesn't mean that you don't do anything about it. And today we have doctor after doctor, scientific paper after scientific paper showing you the impact of chronic stress on your immune system.
And cortisol is known to impair your immune system. So high levels of cortisol is definitely going to do that, right?
So cortisol is good for us. We need it. But when it's chronically high, it moves us immediately into a hormonal imbalance. And if we're in a hormonal imbalance, what are hormones? They're chemical messengers, constantly telling your body and yourself what to do at the right time. So for example, just to explain to everyone, because everyone's saying, oh, it's the cytokine storm. Let me make it as simple as possible. So cytokines are groups of proteins. They're part of your immune system. They are responsible for the cell signaling pathways, which means your immune system uses them to signal. It's a good thing. And you have something else called interleukins, which is another group of cytokines that work with your immune system to turn off and turn on inflammation. So once inflammation is produced to protect you, it needs to be switched off after a while. The interleukins come in. But when the interleukins are not switching it off, the inflammation starts to kill you. So you see, it's a malfunction of your own immune system. Again, so yes, cortisol is good for us. It's what motivates us to get up, work, have reflex actions. But when it's chronically high because of chronic stress, we drop testosterone, estrogen increases, thyroxine decreases, insulin decreases, and we have every lifestyle condition which is related to stress that comes up.
An example I was giving somebody of the cytokine storm was comparing a carpet bombing versus surgical strike. Typically, our immune system has the ability to do surgical strike and exactly go to those cells and repair them. But what happens in this case is your immune system loses the capability of targeting. So it just attacks everything around it, which is kind of destroys all the other healthy cells. And when this is happening in your lungs, it's a big problem because your lung is really where your breathing is controlled and oxygen, and the reason we are all hearing about this oxygen. Can you give an example of why there is so much requirement of oxygen? People are not able to comprehend that, people think that, yeah, I can breathe oxygen anyway. So why do I need supplemental oxygen?
So what happens is when people hyperventilate, the body doesn't utilize oxygen completely. So when you look at patients of asthma or bronchitis or with a lot of coughing or when they're choking, they are breathing in oxygen. Oxygen doesn't stop going in. Otherwise, you'll be dead in less than two, maximum 3 minutes. But what happens is if your cells don't get the right amount of oxygen, they begin to die. So that's why most people are put immediately on oxygen. And of course, it's also the fear factor. So this head doctor told me that, Luke, a lot of them can't breathe. When we're stressed out, like anyone watching this right now, most of you are not even breathing to your full capacity right now. Most of you. And now because I said it, you'll probably take a deep breath. When we're stressed out, it's natural for the body when it's in the fight and flight response, to create shallow breathing. And when we're relaxed, we automatically find we're taking long, deep breaths. So this is the survival mechanism of the human body. So when we're in fear, we start to have shorter breathing. Shorter breathing will have a higher pulse rate. All of these things are checked, and then we know our vitals aren't in place. We're more stressed out, and we require oxygen. And of course, because of the damage being done to the lungs require more oxygen. That's our primary respiratory organ for carbon dioxide and oxygen exchange. So that's what's happening right now. And a lot of people are also running and hoarding oxygen at this point because they think that if I keep like 4, 5, 10 cylinders at home, if I need it, my life will be saved. And that's absolutely selfish, and it's absolutely not the way it works. Because today, a lot of the doctors that we're talking to, they're managing to keep their patients stable without the requirement of an oxygen cylinder. So please keep the oxygen cylinders for the people who need it. It's not necessary to hoard on this.
And clearly, right, this entire pandemic has got a discussion around immunity. And I know we all started by having turmeric and ginger and other things for immunity, but suddenly there is this entire discussion around having, there was ivermectin, which is in fact Goa has told their citizens to have this. And I know, I'm sure this is a very common question you must be getting on what, first of all, what is your advisory on all these various things which governments are doing and saying that people should have them? And secondly, what is a true way to, and what kind of food people can really consume to have at least build their immune system as a prophylactic?
Okay, so Vishal, we are in the field of integrative medicine. We have our own medical vertical. We're not against medicine, but I think everyone needs to understand that allopathy, the principle of allopathy is to treat a symptom. It's not designed to be preventive in nature. So if people are popping pills thinking that they're going to prevent the onset of a virus, it's impossible because the mechanism of allopathy doesn't work on prevention. It works on treating a symptom. So what's happening is they are trying to connect, the parasites that probably build up in your gut and decrease your immunity and take this. But that's not the best way to do it because every drug has an interaction. And if you give the public the free will to go ahead and take these tablets, and they will do it because the advice is coming from the medical community. What happens when they have an interaction? Because we don't know how many patients are on blood thinners, on steroids, on chemotherapy drugs. And we have to understand, which is why every doctor usually tells you never self-medicate. Why? Because you can have a bad reaction to it. So in these cases, I think this public messaging is not the best thing to do. It's not the safest because number one, there is no data to show that if you take it, you're not going to get the virus. If it existed, that would be the solution right now. The government of India would have declared it. Everyone take this and you're not going to get the virus. So I think it's very poorly communicated and it should be regulated like the WHO said. It has to be regulated. You cannot do that. But the government can be more clear on their messaging of people, asking people to stay home. That's the best you can do right now. Stay home. It's as simple as that. Protect yourselves, protect your family, follow the rules. Don't crowd yourselves up in places and shopping malls and all of that stuff where you have where you're vulnerable to contracting any virus or bacteria for that sake. Do the basics. First, do the basics. Complication is never going to solve any problem. Now, when it comes to food, like I said, my biggest worry about food is, Vishal, like we pulled up in the GOQii data, 1 in 7 to 8 people have acidity problems, gut problems. So you can be eating all the turmeric and the garlic and the ginger, but if you're not absorbing it because you have a poor gut, what's the point? So it's about time people started looking at their digestive systems again through their lifestyles. Things like constipation, things like IBS, things like pancreatitis, things like low stomach acid reflux. These are indicators of a very poor digestive system.
Fatty liver is now one of the biggest conditions in India. I was shocked to read. There was recently a report that we are becoming a country with more fatty liver than even diabetes, actually.
There you go. And that involves the liver. The liver plays a role in your digestion. It's as simple as that. Everything is interconnected in the human body. So I think people need to take steps back. And number one, yes, food has a lot of power. All your turmeric, gingers, garlics, they have immunomodulating functions, which are great. Your immune system needs it. But you also got to focus on cleaning up your entire system, eating your meals on time, no late dinners, learning to chew your food, learning not to overeat, learning to have a lot more home food than outside food. Vishal, let me state this, in the first year of lockdown, a lot of my patients who could not lose weight, they could not control their diabetes, all of a sudden, their levels started to fall in place. The one change was they didn't have access to restaurant food anymore. And these were people who were eating 3 to 4 times outside. Now, somewhere in November, all the Zomatos and the Swiggies and everything opened up again, and we started to see a change in human health. So it just shows us, I'm not against eating outside. I would eat outside maybe once or twice a week, but we cannot forget what data is showing us. The impact of the quality of your food on your own sugar levels, your thyroid and everything else, including your immune function. So I think it comes down to balance again, how we utilize food, how we combine food. I know people who are just eating turmeric pills throughout the day and having 3 to 4 tablespoons of turmeric. No, you don't need that. More isn't better. You can have half a teaspoon of turmeric with a dash of black pepper and maybe a couple of drops of coconut oil or pure ghee, and that makes food synergy happen. The benefits of the turmeric gets absorbed with the piperine from the pepper, and your fat medium is the emulsifier that makes sure it gets absorbed into your system. That makes it powerful, not more of it. So when it comes to nutrition, it's the simple things that work.
See, the problem is that we as humans always want a shortcut and we need a pill for everything, right? And I think one of the reasons we kind of went to antacids and all these kinds of things, because it was a pill and it's a very easy solution. And so is supplements, right? Even though supplement sales are high, just mindlessly popping supplements is not going to help them. So what is your advice to people on how do they truly get the required vitamin B or vitamin C or D3? Because people are thinking that they are eating all these zinc tablets, but I don't know if this is really helping.
So what happens is, Vishal, supplements are good and bad. The word supplement means to supplement a deficiency. An X amount of magnesium and potassium and vitamin C's from our spinach and our carrots, but it's depleted. It's growing from depleted soils. So that's why a lot of people who even come to us say, look, but I eat vegetables and fruits and yet I'm so deficient. And then we have people who eat actually farm grown food and they have all the nutrients and no deficiencies at all. Of course, supplements play a huge role. Sometimes when you're on medication, everyone should know that every allopathic drug that you take depletes some vitamins or minerals from your body, which is why a lot of doctors will give you a tablet as well as maybe a multivitamin or a B complex because they know they need to balance it. A lot of doctors don't do that. And that's what happens. Then you start getting new conditions caused because of the side effects of your primary drug. So number one, if you want to get a variety of vitamins and minerals, your diet has to be like a rainbow, like they say. We should have colors. We should have different things. But we have a bigger problem in the world, Vishal. People are chasing fad diets only to lose weight. So they're not eating certain fruits, they're not eating certain vegetables, they're not eating all of that stuff. And they believe that a commercially made supplement can give them all that nature would otherwise give them. And that's a big problem as well.
So currently, given that everybody is in a lockdown, we can't go out as much to get vitamin D. So is there any recommendation you have given? I mean, of course, from a long-term perspective, we need to change our diets, etc. But what can people do for themselves and their families, and especially kids? A lot of people are worried about kids. What can they do in the next 2, 3, 6 months, from a medium to a short-term perspective?
So Vishal, again, I mean, the one thing that we realized is during lockdown, not many people, at least the most fortunate people, no one ever had a complaint about not being able to get fruits and vegetables in the market. Everyone managed to get it. So it comes down to that. I would supplement. I'm taking a multivitamin every single day because I'm not getting as much of variety that I would otherwise get. So a lot of our patients are on multivitamins again because they're not getting that variety that we're looking at. But all of it, because we have to look at the data. When we look at our underprivileged people, I'm talking about migrant workers and below poverty line patients who come to us. We treat them for cancer. A surprising fact, a lot of them are not nutritionally deficient compared to urban India. Wow. So it's not always about having the best quality food. They have strong systems, good absorption. They eat simple food. They have simple digestion compared to all the complicated foods and the oils and the hidden sugars that we have. I'm yet to see patients of below poverty, a lot of them. Some of them have the basics like, pregnancy cases of low iron levels and folic acids. But a lot of other people, they're actually quite good when it comes to their ability to absorb good nutrition. So through this point, I would urge everyone at home, again, order your vegetables, your fruits and stuff like that and have a balanced diet. Your nuts, your seeds, your legumes, your lentils, your whole grains, all of these things. If you can get every part of these micro and macros that I've spoken about, you're typically good. Now, if you have a deficiency, take a supplement. That's why even doctors today are telling you, take your zinc, take your vitamin C, take your multivitamins because it's necessary, because no one really gets their diet perfect. And so the second issue is the quality of food. So at this point, a multivitamin is definitely recommended. It is definitely recommended so that you make sure that you're not going into any deficiency.
And I think what you just said, right? I was recently hearing the interview of the BMC commissioner, who said that the wave one had impacted the people in the slums and the poorer segment, and actual mortality was not that high there.
Exactly. They
But
recovered.
the recovery was higher. I think now that the virus has actually hit the middle class as
Yeah.
well as the upper middle class,
Mhm.
there we know the prevalence of comorbidities, which is
Right.
why, to some extent, the kind of lethalness the virus is showing is much higher. So, is there anything which can be done if I am a parent, right? I am a mom, I am a father, and especially now for kids there is a big challenge. There are several advisories coming in. Do you have any recommendations what we could do for kids?
So I think, Vishal, everyone's handling it very, very differently. I think we first have to understand kids of different ages. They're resilient. They get worried if they see their parents worried. So parents are constantly talking about the deaths that have happened. Oh, someone died in our building, or they're watching the news on loud, and the children can hear this and they see this grim expression on parents. Kids look at parents as their role models. If the parents are threatened in any way, there's fear in them, there's insecurity, there's anxiety, there's all of these negative emotions. Children pick it up like this. They pick it up like this, and then unconsciously or consciously, the fears set into them. So we have to be role models through this, and we have to be strong in front of our children. If anxiety is going to hit us, I'm not saying suppress it, do it behind closed doors. So number one, we got to lead by example. Number two, we shouldn't make a big deal about it. Yes, children are locked up at home and all of that. It's a problem for everyone. I don't want parents or human beings to ever forget that human beings have this insane power to adapt. We can all adapt in the most difficult situations, but we put our own barriers and our own obstacles that, oh, this and oh, that. But beautifully, if you allow for it, we'll adapt. Children will figure it out. We'll figure it out as parents. But on social media, all the parents are, oh no, I don't have my peace. I don't have my quiet, my children. How do I keep them entertained? Just do it. It's as simple. Don't make a big deal out of it. When we make a big deal out of small problems, they become big problems. Yes, it's genuine. Children don't have time to play with their friends. That's why as parents, we need to spend more time with them. We need to give them more of that physical time, spend time with them, because children crave that playtime and that attention. I definitely advise for children to get onto more Zoom calls with their friends to keep that bonding strong. Don't cut off completely. Limit social media and iPad time. I mean, give it to them, but structure it, because the more they get lost in the virtual world, you lose inner connection with yourself, and children lose it the quickest. Then all of a sudden, they start getting bored more and more, and they need more and more of what stimulates them. And reality doesn't stimulate children or adults. It's the virtual world that does. Number four, if you're worried about your kid's immune system and you can't get them to eat vegetables, fruits, you have to do one thing which is difficult: cut down their sugar. I'm not saying stop it, but cut it down, because we also know scientifically that more sugar, lower immunity. So if you want your kids to have a stronger immune system, cut down their sugar intake. Now is not the time for them to be junking and overdoing it on all of this stuff. Keep a balance. Give it to them. They're kids. But it's got to be more of wholesome foods and less of junk and less of sugar. Keep children involved in what is happening. Ask them for ideas. So, I have a 7-year-old daughter, and she gets to know all of these things happening. I'll say, so what do you come up with 5 ideas that you think you can do to make the world a better place right now? So involve them and let them keep thinking in a forward, positive manner. Don't let them get sucked into negativity, because adults can't handle it. Imagine kids, they'll be swallowed. So these are a couple of things that we can do.
And I think one very important thing what you just said is right. See, kids are going to, you are the role model for your kid as a parent.
Absolutely. Mm-hmm.
They are going to ape you. So first of all, for you to have a healthy kid, what is the example you are setting? If you are going to be lazing the whole day, eating junk food,
Yeah.
consuming alcohol and smoking, and then you expect your kids to follow a disciplined and healthy life, that's not going to happen. They are looking at you to be a role model. So I think uh, parenting is 90% the parent and 10% the kid. You have
Absolutely.
bigger role and bigger responsibility, because see what we are seeing today, is what happened to our youngsters in the last 20, 30 years. And if you kind of closely see, this is when the advent of all the cold drinks and the junk food started in India in the late 80s, early 90s is when all this started. So that generation is today facing diabetes and cholesterol and all these health issues. But today's kids who are 10, 5, 15 years old, when they become 20 and 30, it's up to us what is going to be the state of their health. And I think now, more than anything else, this new term, suddenly every government, every doctor, every hospital, every leader is talking about the word preventive healthcare. And you are the pioneer in this entire aspect of health. So, in your opinion, what is preventive healthcare and how can you simplify it for people so that they can now start adopting it?
So it's very simple, Vishal. To go back to your point, it's sad that a pandemic with so many deaths and wipeouts of families had to bring the word preventive healthcare into the limelight. It's really sad. It just reflects on how society has been chasing quick fixes blindly. So what is preventive healthcare? Everything that we can do within our capacity in the simplest way to prevent the onset of illness. And by doing that doesn't mean you won't fall sick. But if you fall sick, you will recover the right way. A healthy body doesn't mean you'll never fall sick, but you will. Like, how come so many people who are getting the COVID are also recovering? Some of them are asymptomatic. Some of them don't even go through a single symptom. There's a difference in the way they've looked after themselves. So preventive health is everything that you are doing today. I like what you said about 20 years down. What if I am looking at the next 10 years of my life? Like, what am I going to be? How do I want to be when I'm 50? I have to start today. I can't start when I'm 50. If a kid wants to be healthy through university, they got to start when they're at the age of 5 and 6. So because it's a long-term process. There is, like I said, the training of the immune system, your DNA, your stem cell regeneration, a process called angiogenesis. These are processes that govern every disease, prevention or healing. And it starts right today. So whether it's your nutrition, whether it's your exercise, your sleep, your emotional wellness, the quality of food, the quality of supplements, you got to put it together and start today. I also want to go back to one more point that you made, Vishal, because a lot of people are out there in fear that, oh, this is hitting everyone. But break it down. I know people are emotional, because we talk to patients all the time and our doctors speak to multiple patients all the time. You know what? They've come back and said, look, families who have been wiped out, okay, during the COVID, when they were told to be at home, one parent or both parents decided to go out for a party on the weekend. Okay, they went out, they brought it back to their entire family. Their parents die, the kids get infected, the servants get infected and die. Now, this is irresponsibility. There is a dangerous virus, but this is irresponsibility. So we get affected emotionally when we hear of deaths. But like I always say, a coin has two sides, and in our space, we want to find out exactly what it is. Yes, there's a weak immune system, untrained immune system, a virus that's changing. And there's also your own common sense and your own behavior that is playing a part in this. A lot of people who have died are people who are out on the field. There are people out there, whether they're journalists, they're doctors, they're nurses, or they're people, who socialize irresponsibly. So, I think the message is all of us have to now, start looking inside and, questioning our behaviors, our shallow thought processes, because it's not just about a virus and a vaccination. It's way beyond that, way beyond that. So,
I think, 2 points. We always talk about survival of the fittest and health is wealth. I think these two sayings couldn't have become more true in today's world. This is truly become the survival of the fittest, and the virus doesn't spare anyone. It doesn't look
it
at
doesn't.
whether you
Yeah.
are rich or poor. If you are fit enough, your body can survive it. If you're not fit enough, all the interventions are of no use.
And we'll go back to another saying to add to yours. Prevention is better than cure. I remember we used to learn this in school. For the longest time, prevention is better than cure. Prevention is better than cure. And Vishal, I like what you said about it. The virus doesn't spare anyone. You know what we've learned during the last couple of weeks? Even the richest of the richest people, their wealth and their money and their arrogance and power couldn't buy them a bed or couldn't buy them an oxygen cylinder in these cases of desperate times. So I think these are messages that we learn, that humanity We're all equal. Whatever it is, we should never use arrogance. Yes, some people have a lot more than other people, but we should learn humility. We should learn humbleness, because now people found out that even their wealth and their money and their connections with politicians and government and anyone, it just couldn't work. No one could get what they wanted. So because a lot of people think money can buy back lost health, and it can't. It can buy you a more comfortable bed, maybe. It can buy you a more comfortable bed in hospital, maybe a 7-star room and stuff in a hospital, but it can't take away suffering. For that, you got to make an investment, whether you're poor, rich, fat, happy, beautiful, ugly, whatever it is, you got to invest in your health.
Luke, you are also among the very few people who talk a lot about gratitude, the power of prayer, and the power of meditation and mindfulness. What role do these things play when it comes to preventive health or immunity? Because a lot of people just think of this as, oh, there is no science behind it. A lot of times these things are discounted by the community. So, what is your view on that?
So Vishal, science is great, but the people who keep chasing science with stupidity and no common sense are the unhappiest people you'll ever come across. I had someone the other day like, give me the science behind why I should sleep. Number one, there are thousands of documents out there. He's not searched. Number two is, dude, if you don't want to sleep, don't sleep. My point is the generation, some of them hide behind science as an attention-seeking mechanism. Yes, there is science. My question is, we should follow it, respect it. But what about intuition and wisdom and so many other things? Where did science occur in the last 1 year with COVID? Absolutely nowhere. People who didn't believe in God began to start praying. People who didn't believe in gratitude started to practice gratitude where science failed them. So have science in your life, but you can never, ever. There are mysteries in life that no human being understands. No spiritual leader understands. We all talk about it. We read about it because it sounds great. There are mysteries in life which will remain mysteries in life. But when you practice it, if it makes you feel good, do more of it. There are a ton of people in the new generation and in the older generation. The science says do it, they do it, but they don't feel good. Like, get on this diet, but they're unhappy. The diet doesn't make them feel good, and they never get their results. So things like gratitude, these are natural laws of life. What you are grateful for, you get more of. What does meditation teach us? A lot of people think, oh, I meditate for peace. I always tell them, don't meditate for peace, because if you're meditating 1 hour, you just have 1 hour of peace in your day. Meditate for clarity. In that 1 hour or 30 minutes or 20 minutes of my meditation, I want to be so calm so I can be mindful enough to see what I need to change, what I need to do, how I should tame my ego, where I'm failing in life because of my pride or my own, skills or whatever it is. Meditation brings clarity and mindfulness. What the world needs right now is to live with awareness and consciousness. We've not been living with consciousness and awareness. You see consciousness and awareness happening now with so many deaths happening. You see now people have come together on social media, which at some point was tearing people apart. But humanity's come together fueled by emotion and by death. So the spirit of humanity exists in all of us, and it's a beautiful spirit. We can bring it to life when we practice gratitude, mindfulness, meditation, silence, reflection, giving back. Giving back. I don't have a single person. I challenge anyone out there. You can be at the lowest point in your life. And if you want to feel better, give back from your heart, whatever it is. It doesn't have to be money. It could be your time. It could be whatever. And you will feel better. And I've done these experiments with hundreds of our depression patients, and they feel better. It doesn't take away their depression, but the point was to feel better. So if it makes you feel good, you should be doing it, because a lot of things that we're doing, they don't make us feel good at the end of the day. So yes, there may not be science. And my second thing about science is, Vishal, we have to face it that today you can pay for science. You can channel science. And if you look at the science, the research that's done, it's always around something that can be sold, scaled up, or made into profits. You don't get anything out of studying yoga, putting research and science behind yoga, meditation, gratitude. There's no money to be made. If you teach meditation and half the mental illness goes down in the world, that's a slam on the industry to millions and trillions of dollars. Why would science ever want to study it? So there are all these little truths. That's why I want people to use common sense. If you're grateful and it makes you feel good, be grateful. If you're mindful and it makes you feel good, be mindful. Don't wait for science to tell you be mindful. Don't wait for science to tell you to pray. I think people waste their life waiting for science to tell them what to do.
So in fact, Luke, another very interesting point here, and I want to kind of simplify this. and show you, and of course you being a big inspiration behind this entire framework. So we were working on a framework to define what could be immunity. How could you create a framework? And I'm just sharing this one slide for everybody, because the idea was, and since my background is in the world of gaming, we said that
Yeah.
if life is a game, it's a game where you only have one life. Unfortunately, in the real world, you only have one life. In computer games, of course, you can have three lives or seven lives, depending on the game you are playing. Now, if you have one life, the only way to win this game is to live longer and healthier. That's longevity.
Yeah.
But how do you develop longevity? So, the kind of framework we are talking about for preventive healthcare is leveling up your immunity score, leveling up immunity. And the way to do that is focusing on five key elements, which is sleep, nutrition, fitness, cognition, and happiness. And these are really the five key pillars of working towards developing your immunity. And what you just beautifully talked about was all these different aspects. And of course, the most important aspect being happiness. So,
Yeah.
from this framework, do you want to derive some more insights on how people can adopt this in their daily lives?
Yeah, I want to make a couple of changes in your framework, Vishal. I want to bring happiness and sleep and put it as the base because they both work together. They both work together. You can never find a happy sleep deprived person. You're going to find an irritable one. And I like your model because you've aced it on the sleep. Bring the happiness down because if you're happy and you sleep well, it determines how you eat. Someone who's sleep deprived is going to crave carbs and sugar. And even if they use willpower to deprive themselves, they're unhappy. Then you have nutrition, fitness, cognition all together in this beautiful pyramid that you've put together. I would add spirituality. Okay, I'll tell you why. Because spirituality is the core of everything. It's the core of it. And when people say, look, what's spirituality to you? It could be kindness today. It could be helping someone. It could be investing in my sacred body because I'm given a gift of this life. Okay, it's my tool. It's my vehicle. How can I use it on this earth in this one lifetime to number one, nourish myself, enjoy every aspect of life, and also use it as a vehicle to give back, create impact. So I got to invest in myself. So spirituality to me could be investment in my own self, physically, mentally. Spirituality for you could be kindness. For some people, it could just be appreciation. For some people, it could be, because I think spirituality has become a fad as well today. Everyone talks big about spirituality, but no one practices it. That's why they're constantly reading self-help book after self-help book. So I think spirituality is the core of everything. Because I respect my body, I do what I'm supposed to do. I don't need motivation all the time. Motivation is short-lived. So I would put in the spiritual angle, like in the center of the pyramid, I would put spirituality. So that drives all of the other parameters that you so beautifully put there.
Fantastic. I think spirituality is absolutely the need of the hour. And I think, this whole question of mind body connection, you talked about mind, body, and soul now. I think that's really where we are, right? I think we've always been very body centric.
Yeah.
Largely, people want to be very, very cosmetic. A lot of people were doing, all these workouts, etc., for cosmetic reasons, and we know.
Yeah.
But the minute you are doing spirituality, you can't do it for cosmetic reason. You have to do it for the true self. And I think it is absolutely important. Talking about spirituality, I think one aspect of health which we talk about is emotional well-being. And today we know that people are massively suffering from mental emotional trauma. I think the amount of deaths are happening. I have given, and I'm sure with you and everybody here, the number of condolence messages we have given people is more than what I may have given in my entire life, what I have done in the last few weeks. And a lot of people are dealing with the death of a close family member or death of somebody in their extended circle. And there is death everywhere, right? You open Twitter, Facebook, you can only read about this. So how, and while it is easy, is there any tips you have on how people can take care of their emotional state, especially in these times?
Okay. So Vishal, this is something that I've gone through all my life because ever since we work with cancer patients. I mean, it's a common morning for us to wake up with 5 or 6 patients dead over the last 7 years, and I've learned about death through my own patients. Several times I've had patients who have lost their entire families through a disease or a car accident. And we ask them, how do you manage it? And yet you're smiling today. He said, see, listen, at the end of the day, we've gone through our grief. Death is it's going to happen. All of us know that death's going to happen. But what can we take from that lesson of what death has happened? Never, ever to take life for granted. Don't postpone your happiness. Don't postpone that call to your parents. Don't postpone saying I love you to someone just because your ego and pride is in the way. Yes, anyone dies. We are going to go through grief. All of us, let's face it right now. We are. It happens sudden. Why is it more emotionally draining on us? Because many people have not had a chance to bury or cremate the dead bodies or spend time with them. Some people have been in the US. Their parents have died in India. It's a tough time. But through toughness, we should never forget to take the lesson. We should never forget to take the lesson from what it is, that death can happen to anyone. It's not within our control. Are all the difficulties that we're going through in life right now worth the fight? Is all the unforgiveness, the envy, the anger that we're holding on to worth it when death is going to strike us or our loved ones at some point? We can take a lesson from this. Grief. There's a beautiful saying about grief. The more you grieve, it's because of our grief is because of the unspent moments or the opportunities missed spending time with the person who's died. And that's why it can never be enough. Like if my mom dies tomorrow, even though I've had a year with her in Goa, it's not enough. But it's something to look back and value on. So again, mindfulness, appreciation of moments. I had a young guy, he got off the ventilator and he was unconscious. He woke up to the news that his wife was dead, his 2 daughters were dead, and his parents were dead. 2 days later, I called up to check on him, and we spoke on FaceTime, and he was smiling and all of that stuff. I said, listen, if you have expressions, express it. You don't have to hide behind a smile. I said, Luke, I'm smiling because the last 2 days I've just been focusing on all the amazing memories we made while they were alive. Now, he was using that as a coping mechanism. Of course, he's grieving, but look, he's taken that grief and he's used it in a positive way to cope. So there are different coping mechanisms that we can always use, but what we can learn from death of other people around us, I always say it's unfortunate that other people around us have to die, but what is the lesson that you can learn? And if we don't take away that lesson, it's really, really sad that we don't evolve, we don't grow.
In
so
fact,
we learn to start spending more time with our parents.
More than the lesson, what I tell people is channelize the energy. So if you think something went wrong, tell us how can you fix this rather than blaming the government
Move
or
to action.
the hospital or blaming somebody else. If people died of oxygen, you should work tomorrow that in the future there should not be a shortage of oxygen.
Absolutely.
Let's put it that way rather than trying to blame, which is the easiest. I know we don't have much time. I think I just wanted to end by the one thing, which is vaccination. I'm sure you're getting a lot of questions around it. A lot of confusion. There is more vaccines coming. There is Sputnik, there is Covaxin, and there is vaccination of kids. So what is your view? What is your suggestion to people? And how do you want people to look at their life post the pandemic?
Okay, so it's very difficult to say. I don't want to have a personal opinion. Of course, I do have a personal opinion on vaccinations, but my advice to everyone is follow the advice of your government and your doctors. Okay, because that is what we need to do. We don't have to create more chaos by using our personal opinions. The personal opinion that I like to express and debate with myself is that, yes, usually the trial time for an effective vaccine is years. And we don't have that. So we can expect complications. We can expect things to go well and not go too well. But at the same time, it has to happen if we want to contain everything. So yes, we can look at our personal emotions coming in the whole thing over here. Everyone has their opinion, but we got to do what is right at the end of the day. Now, how can I make it more effective? There are things that you can do before your vaccination, which GOQii's already shared with the world. Sleep well the night before. All science, hard-hitting facts about how you should make the vaccine more effective for you. Antibodies, your sleep before, your zinc supplements. Take the vaccination with faith. If you're taking it with fear, nothing done with fear ever works for you. If you're not going to take it, just don't take it. That's it. That's my point. But at some point, if you have to, you have to. Of course, like my mom.
You have to surrender. You have
to surrender it. Like my mom has COPD complications and her own doctor said, listen, wait for a while. You're 70 years old, wait for a while. Don't be in a hurry, but don't leave your house. So there are doctors who are also giving you They're not blindly saying, go ahead and take it. Some of them are telling their patients, hey, wait for a while. We'll tell you when to come. So, once you remove emotion and fear and anxiety, we have a beautiful word called clarity, which is left. And that's why I want people to be a little more calm about their approach, and we should do what is necessary at this particular point.
And what is the world post this pandemic? I'm sure if not today, maybe in the next 12 months, 18 months, this pandemic will be over.
Yeah.
Where do you see the world of health going after that?
It's very difficult to say, Vishal, to be quite honest, we know that behind us, businesses are now all focusing on healthcare and preventive health. Why? Because they're expecting it. I'll tell you what, we've gone through situations before the pandemic before, just to ease the burden of everyone, there are more diabetic deaths and more cancer deaths on a quarterly basis, more than the amount of COVID deaths that we've had in the last 1 year in our own country. It's just where the focus is. We should never forget that. My point is the world can be a better place if human beings are willing to make change and take personal responsibility. We have to dissolve selfishness. We have to dissolve selfishness at a very, very large level. We can have a better world. It's up to us. Or this could be something that keeps happening. Today, it's one virus. Tomorrow, it could be a bacterial infection. It could be a combination of viruses. So I think it's up to us, every human being. It's not just up to the government. It's easy for human beings to say, we want a better government. We want better healthcare systems. What about you? What are you doing as an individual to make yourself a better individual? Half of the medical infrastructure is under strain because of lifestyle diseases. Healthcare should be for everyone. It's usually for emergency cases, really bad cases. But if you are treating, if the infrastructure of a country is treating diseases caused because of your lifestyle is poor, that reflects poorly on society, not just the government. It reflects poorly on you. And that is the change that we must all be. That is the change we should all make, one individual at a time. Do the little that you need to do. Take the burden of the infrastructure. Keep the hospitals for deadly diseases. Keep the hospitals for accidents, for emergency cases, all of that. That's how you'll even bring down the price of healthcare. But lifestyle diseases is chronic illness. Chronic illness is where all the money is, all the profits are. So if we're going to make a change in the future, it's got to be us. Yes, we want a better government or whatever it is people want. I don't know. That's not going to make a difference. I can promise you that right now. There are many countries that have solid healthcare infrastructures, but it doesn't matter if you don't make a change at an individual level. So the future depends on us. And then there's destiny. We don't know what can happen.
So like you said, Luke, with that, we have to be the force of change. We have to be the force of transformation, and we have to be the force for ourselves and our families, right?
Absolutely.
You are not going to set an example for yourself. There is no way your kids, your family members, and others are going to listen to it. COVID has been a wake-up call, not only to us, but the entire world. And now I think going forward, the best respects we can pay for all the people who have lost their lives is by promising each of us that we will work towards building a better society with health and preventive healthcare as a foundation.
Absolutely.
Thanks a
And
lot.
that time starts right now, Vishal. It starts right now. It doesn't start tomorrow or next week or after the weekend. It starts right now because our bodies never stop working for us. They're working for us right now. So why should we postpone starting to respect our bodies to after the weekend? Awesome, Vishal.
Thank
you so much.
Thank you. Thanks a lot. Take care. And
All right.
thanks a lot, everybody. Thank you.
Thanks, everybody.